Welcome to the Extraordinary Health Podcast.
Where we aim to get you back to your full potential.
And I'm Dr. Paul Beckham, and I'm here with...
I'm Liz.
I'm Allie.
And today we're going to go over performance optimization. And with performance optimization, I mean, that's basically the services that we offer with our chiropractic services every day here. I mean, that's our main thing that we're looking at is how can we literally, get you back to your full potential here. And, hopefully us in the meantime, get you to finally feel good. So, with the patients that come into the office, I mean, what are some of the typical things that you guys even see walking through the door that come in the office to get treated?
Like first appointment?
Yeah, I mean, what are some of the typical chiropractic type patients that...
Low back pain.
No, low back, cervical spine issues, a lot of hip issues too.
Hips, knees, back. Yeah.
Yeah. And I think that's just the one thing that, people think of hip and they think of, and they'll point to like their lower back, and that's really their sacroiliac joint that they're talking about. But what we're really seeing in the office here is more your femur, where your upper portion of your leg attaches to your pelvis. There's a lot of patients coming in here that have hip issues. Usually, I would say the majority of them are like a hip strain where they've strained the muscle, like their iliopsoas muscle, and they've lost now some of the range of motion in their hip. It's just not moving like it should, and then that's even throwing their back off. And a lot of these patients are coming in. We might even be their third, fourth, fifth, sixth, seventh place that they've gone to here, but I think once we get everything kind of working properly, and it gets into the biomechanics of everything here, and if we just focus on the spine, we're going to be completely missing these hip issues that people have, and even knee issues below that, or even foot issues. So we're evaluating all of that through some manual means, and Liz and Allie are doing a computerized video kind of analysis of you that literally gives us, how you're moving in, specific degrees of range of motion, so that we can get to the most appropriate treatment here. And usually I even like to see it kind of match up with what I'm finding with your physical exam and testing things like range of motion and how it's moving, muscle strength, and just how much, not necessarily how much strength you have as far as, can you lift 1,000 pounds here, but more on the functional aspect here, and do you have that proper connection kind of between your brain and the muscle that we're testing there, because that's where a lot of people are having problems. And then we just need to dig down and find just where that problem's occurring at. I mean, because it could be in the muscles themselves, it could be with the tendons, it could be with the joint capsule, or the ligaments that are going around the bones there. You could be starting to wear a joint out, like a hip. Maybe you're starting to get some mild, moderate, or severe degeneration going on there. Same thing with the knee. And if that's the case, then there's chiropractic in and of itself isn't going to take care of that, but a lot of the other kind of modalities that we have in the office are going to help deal with that. So what's one of the modalities that we've been using in the office here that really helps people out, like with a degenerative knee?
Shockwave.
Mm-hmm.
Yeah.
I think shockwave would be my first go-to with that one. You can get so much... It's very effective pretty quickly.
Yeah.
I mean, people find relief right away with that. And it's probably our most intense therapy, but it's also, I think, a good first step for a lot of those degenerative issues too, because of what it does.
Yeah.
Breaking up that scarred tissue, increasing that stem cell production.
Yeah. I mean, with shockwave, there are a lot of people. I mean, it's intense when you have it done. We're going to run it, at a pain point, where they're going to be asking you as they're running the therapy in the office here, how would you rate that pain on a scale of 0 to 10? Because it's all dependent on you when you're getting the therapy done. But typically run it at about a 4 to 5 out of 10. So it's a bit intense. It's not intolerable or anything like that. But usually the big thing once we get done is that most people have at least a 50% pain reduction. I mean, some people have 80, 90% pain reduction. It helps out pretty quickly. So you definitely know, even with that first treatment, that yes, this is, improving my situation here. So.
Oh, yeah. I even think of, I mean, not talking about like the knees, but I remember, Allie, when I did shockwave on your plantar fasciitis.
Oh, yeah.
And I remember you were in a lot of pain and did it literally right on your arches pretty much. And she stood up after we were done and she's like, it already feels immediately better. Like,
yeah, it felt incredible. I felt like I could start jogging and training.
Hey,
like next stop 5K, which is where those issues kind of started to begin with.
From running,
and hopefully not back into treatment, right?
Well, I know, as long as you maintain. I mean, that's what performance optimization is all about, right?
Yeah,
maintaining your body, giving it all the things that it needs to heal and perform optimally.
Mm-hmm.
And yeah, like with the shockwave, I mean, most people are going to feel that difference. So yes, we're hopefully going to finally get you to feel good here, but we need to get you to the point that you can operate as close to your full potential as possible here. So usually there is a series of treatments with that to get you to that point if you're having, pain and inflammation from an arthritic knee or an arthritic hip, shoulder, whatever it happens to be. Immediate knowledge to know that that's helping you get better right away is like, okay. But again, depending on your severity, is going to depend on what we need to plan into your treatment plan for you as far as how much of that you might need to get to the point where, yes, you're operating as close to that full potential as possible. So how about, we get patients coming in that have, a joint that's just kind of painful. It's a little swollen, inflamed. What's something else that we use in the office here to help out with something like that?
Oh, is it time to talk about the laser? Yeah, as soon as you said like pain, inflammation, like
immediately you think laser
treatment for sure is the way to go on that. I mean, it has been FDA approved, for pain reduction, and it definitely does its job on the inflammation, which is more often than not causing some of that pain. So yeah, that's the best next step on that one.
Yeah. And the laser that we're using is for helping reduce pain and inflammation. It's not dangerous at all. I mean, the only thing you might feel with it is a bit of warmth. We even have one coming in now that'll be even stronger than even the current one that we have. So what that does for a patient is actually speeds up the treatment time for you there. It will take about 20% of the time of the current one that we have. And the one we have right now has been one of the strongest ones that's been out there. And even for things where people come in and have like neuropathy going on, a full treatment, if we're going to do their full legs to actually get them treated here in office, would take about a half an hour, even with our 20-watt laser that we had before. Having a 100-watt laser coming in here, and now all of a sudden we shrink that down to 6 minutes. You can get in and out of here pretty quickly with the treatment and, not have to spend a whole lot of time in the office here. There's still going to be things that we'll have you do at home that are going to be more related to, obviously helping you sleep and all that kind of stuff to help, improve your performance, because if you're not sleeping, your body can't heal itself there. Other things you're going to pay attention to is just making sure that you're using some of these areas as well, because if you keep favoring them and don't use them the way they should be used, it's going to be hard to get it back. I mean, and especially if you've been favoring it for months, years, decades for some people, it's still, we can get a lot of improvement for people even with just chronic conditions too. So
yeah, a lot of people don't realize like how important it is to have balance in your body, not just your life, not just your work-life balance, but balance within your body too, because like Dr. Beckham was saying, if you're favoring things, that's a great way to lean into some serious dysfunction.
Well, it just causes even more.
Yep.
And that's one of the big things that we're trying to do in the office is, yes, make sure that, as far as chiropractic wise, if you want to think of it, making sure that your brain is connected to your body. So we always want to make sure you have that proper nerve signal going to every part of your body there, because if you don't have that, it's hard for your body to even know what's going on, what's working, what's not working. It's really good at then shutting things off so that you don't use them. And that's where people start to run into problems, because then they never go and get a condition treated. When you were younger, you might have been told to just rub dirt on it and keep going or whatever.
I still say that.
It might be fine if it's just a minor injury, but it's still something where, hey, if you can get something treated right away, the chances of you then having long-term, repercussions from an injury like that just get to be, minimized then.
Yes, you should rub some dirt on it with nip it in the bud.
There we go.
Get it looked at, get it taken care of, and, make sure that, you don't have that problem happening in the future. So, and a lot of people, if you get that problem treated right away, the chances of you then having, a chronic issue in that area just gets very, very minimal. So,
well, and a lot of times too, the barriers for people getting in and getting treated right away is maybe they feel like they don't have the money to do so. But a great way to ensure that you're spending way more money on your treatment is to wait too long to get in. If you get in sooner, you're going to have a better chance at getting that optimal performance sooner than later. And it's going to cost you a lot less money, a lot less, pain and everything in the long run. So don't wait. Don't hesitate. If you want to perform optimally, then you need to do it as soon as possible.
And especially if you are in a sport and you want to be able to get back. I mean, I think typically, what we see in the office is people are getting back in about half the time of what normally is kind of seen. They can get back to their sport. They can get back doing what they love to do. I mean, obviously, if you've torn something, it's on that sphere in the spectrum. We're not going to be able to do that. But a lot of these people that are mild, moderate, on that edge of severe, I mean, you can get a lot of things healed up pretty quickly here and be back doing, the sport that you want to be doing. So, and there's not too many things that we don't have in the office here that we could be using to help you get back to a sport or get back to those activities that you want to be doing. You want to be cutting your grass, blowing snow.
I don't know if you want to be out there blowing the snow, but you want to be able to do it.
Yeah, you want to be able to get your driveway cleared so you don't have like one big snow pile you're driving over every single time you're backing out of your driveway. Never mind if you can turn your head around to be able to see it in the first place. So.
Mm-hmm.
Then you wonder why you have to replace your garage door. No.
Been there.
See, the problems will pile up.
So other than that, I mean, other big things that people kind of run into here that come into the office, we have patients that have things like, fibromyalgia, chronic fatigue syndrome. What's the therapy in the office that really can help those types of patients out?
I would say PEMF for sure.
Yep. And I was just happened to watch a video here from Dr. Pollock, who's a medical doctor that uses PEMF a lot, and he even called it an electroceutical. Just like you think of like nutraceutical or a pharmaceutical, it's actually it's kind of a prescriptive dose of electric current. It's basically the same thing that the earth is putting off. It's just magnified. And it helps to stimulate especially the mitochondria in your cells, which are the part of the cell that's producing energy for your body there.
Cell.
Yeah, the powerhouse.
Everyone knows that the mitochondria is the powerhouse of the cell. It's the one thing we all remember from fifth
back
grade
to like
science.
I was going to say biology. Yep.
So go PEMF yourself.
PEMF, yes.
So using pulsed electromagnetic field therapy is what PEMF stands for, helps to power the powerhouse of the cells, the mitochondria there, so that they can produce energy for your body to get around every day. And it can just literally make a huge difference for people. And again, with that therapy, they're going to notice it. A lot of people notice it that first time again that they have that done. Like the PEMF therapy we have in our office is a high intensity PEMF, so you'll feel it when it's running. And we can even turn it up to the point where it's motor intensity. You'll literally, your shoulders will be jumping around or your muscles will be jumping around because of, the electric stim. It doesn't hurt. Usually it feels really good. Most people, and again, depending on really a frequency that we use here, it helps with kind of different things to just help those cells get charged back up and function normal again. chronic inflammation in the body has also helped out as well, because it just improves the circulation. So that's another way that we can help you get back to your full potential, and just by optimizing your cells performance, because we're exercising those cells using this therapy, and there's really no other way to do it to that intensity other than you can probably do grounding, is what they call grounding, like walking on a beach in bare feet. You probably don't want to be walking on your bare feet in
not right now, would not recommend.
Wintertime right now, unless you're super crazy and actually have no feeling in your feet, probably from neuropathy or something like that. But there you're just setting yourself up for a really bad situation. So anything else you can think of with PEMF? I know we have other patients that have things like Lyme's disease that it really helps out a lot with, just gets that blood flow going really well.
Arthritis,
yeah. And I mean, if somebody's kind of more got like arthritis that's affecting more of their body than just one specific area, we do have like paddles and rings and different things like that, so we can really localize it for people too. But most of the treatment with PEMF, there's a zero gravity mat that you can lay on that covers your whole entire body. You'll probably feel it a bit more because they have more coils that are like in and around your shoulders and head and neck region with that one. It's basically a rocking chair that we have another set of pads on, and that one you really feel more through that lower back, hips and pelvis, and we even have a mat that's more like on a footstool basically, and you can take that off and you can literally use them to kind of sandwich yourself in between some of the pads, so you really are driving some of that therapy through your body there. And I don't know of anybody that really does not like the therapy that hasn't had any good positive benefits out of it there. So
if anything, it's an excuse to take a nap.
Right? Everything I read about PEMF, I'm like, what doesn't this thing help with?
Seriously,
honestly,
though.
like there's very few things that are contraindicated when it comes to PEMF, or things that you don't want to treat with it. But I'm just constantly amazed. I mean, I even use it for digestive stuff. When I have like an upset tummy, I sit on that chair, and get the waves coming in from the backside, and then I put the pad on my tummy, and I feel better. It's crazy.
Well, it's improving the blood flow. It's just get everything functioning. It's down to a cellular level, just better. Just because you're getting that charge put back on them again. Your body's like a battery, and it just kind of slowly loses, charge. Some of the big things with that too are also to just make sure a person's getting in enough minerals. I mean, magnesium would be the biggest thing here, just to get that in your body. Almost everybody is kind of low in magnesium because you need magnesium for a lot of biochemical processes in your body, and it just gets used up. So you can run into some issues if you take too much of it here, but there's different forms of magnesium to take, and if that's something you want to look at here, just give the office a call and we can, help direct you in the right direction to get the most appropriate magnesium. That'll work best for you because it can help out with sleep, just general relaxation, getting your body's cells to just communicate better. It is lots of positive effects there. So I guess something else here to help people get back to their full potential as well. I mean, we have a lot of patients that, I've even seen some women as young as like 27 years old that have degenerative discs already in their neck because they've been staring probably since they were teenagers down at their cell phones, and they already have some mild to moderate disc degeneration because they're just loading those discs in a way that they're just not meant to be loaded. So
we can treat young men that do that too, though, right?
Young men as well. I just happened to have had two 27-year-old ladies that came in, and
no, they were recent patients, yeah.
And everybody, how many people probably don't have tech neck right now?
Seriously, I just walk around a store one day. I challenge anyone listening to pay attention in public. Everyone's got their head down.
Oh, definitely.
Everyone. Yeah.
There's not too many people. If you're looking around, you probably think you're a freak.
Seriously. Nobody people watches anymore. Except for the weirdos, right? No.
That's me.
Yeah,
then.
me too.
I'm a people watcher.
But it comes from like I will watch people's gaits and stuff too. But I'm noticing that more and more now as everybody's got their head down, no matter where they are. Just walking around Menards, I mean, people are bumping into stuff because they're too busy looking down at their phones. So yeah, and performance optimization, like that covers everything. You got to think about how you're using your body in space. Like Dr. Beckham said, as young as 27, that's pretty young to be having that kind of degeneration in your cervical spine. So we need to be thinking about how we're using our bodies and what's best for our bodies, because we only get one. Yeah. I don't think we're there transplant wise yet. Full body transplants.
No.
We're going to take your brain out.
Well, I mean, sign me up, honestly. But,
like, I'll take a new one.
But I'm going to take good care of this one while I've got it.
But yeah, I mean, just even seeing those degenerative discs, I mean, some of the therapies we do have that help people out with that. And those are perfect examples like, hey, we need to jump on it now because it's mild. Let's get the proper alignment. We want to get that proper structural alignment back of that spine for them. We want to use some decompression therapy there to help even restore those discs so that we get those back to kind of a normal disc height there too. We don't go into the whole mechanics of that here right now, but I mean, that just can help out tremendously for a person to, first of all, get the knowledge that this is what they have going on. This is why they're having neck pain. This is why they're having headaches. This is why they're having shoulder pain. And it really has to do with their own ergonomics and what they're doing on a daily basis, and they just need to recognize some of this stuff. So I think we've had, kind of covered, a lot of the stuff that we do in the office here. And I think the big thing is there's people that come in with conditions and we end up using, multiple different things together because everybody's different. Everybody needs, a little bit different kind of a treatment there. And we want to, get you a customized treatment plan to help, get you better as fast as possible so you can get back to doing what you love to do here. So you can finally feel good and reach your full potential. So I think that kind of wraps it up. And
yeah, just, let us help you. Help us help you, right? Help yourself.
Let us help you if you have an issue. You can always call the office or email us here. You can even go to the website and schedule online for a free consultation. We can discuss what you have going on, maybe let you know what we need to do to kind of move forward and maybe what we're looking at. If we do an exam, we're going to let you know exactly how long we think it's going to take you to get better, how much it's going to cost, so you can make a decision up front. You don't need to worry about long term, what the cost is really going to be with everything here. We're usually pretty close when we go over that with people. So I hope that helps, and have a great day. We'll see you next week.
Thanks for listening.
Took the words right out of my mouth.